Hello, my name is Monica Pleiss, and I'm an occupational therapist at Munroe-Meyer. Today I'm excited to talk with you a little bit more about what occupational therapy is and how it can help a child with a diagnosis of autism. Today we're going to talk about what occupational therapy is, what does occupational therapy look like, and when should I seek help? So what is occupational therapy? Occupational therapy helps people do the things that they want or need to do across environments like home, work, school, or the community. Occupational therapists, or OTs, often address the needs of children through play, since this is their primary occupation or daily activity. OTs help problem solve sensory processing differences, and improve fine motor skills and activities of daily living in order to increase independence in life. Activities of daily living can be things such as getting dressed and completing fasteners, self-feeding, personal hygiene tasks, sleep, and daily routines. These are some of the main areas that we consider in occupational therapy. As we develop, the skills needed to navigate across these areas change. Infants and young children learn to be social and communicate their basic needs. As children continue to develop, they begin participating in more of their self-care tasks, like bathing and brushing their teeth. For school-age children, the expectations change to things such as paying attention, writing, and organizing their materials and behavior in the classroom. Children can receive occupational therapy in a variety of settings. Two of the main settings that we are going to discuss today are school-based and private occupational therapy. Private occupational therapy requires a prescription from your doctor. This is typically provided in a clinic, and it is paid for through your personal insurance or through self-pay, and this is also available in addition to school-based services. The other way that occupational therapy services can be received are through your school system. This is provided through the school district, and it is outlined in your child's IEP or individualized education program. Consultation to teachers is mainly what occupational therapists provide. However, they also work with the children in the classroom and provide recommendations for the child's team to carry out through their day. It should also be noted that one form of occupational therapy is not necessarily a replacement for the other. A child may qualify for both, or they may qualify for OT in one setting, but not necessarily the other setting. When should I consider occupational therapy services? There are several signs that your child might need occupational therapy. We will look at these next. If your child is having difficulty using their hands to play, this might be a sign that they could need OT. Fine motor skills encompass all of the tasks and manipulation of items we do with our hands. Children typically develop these skills through play. OTs can help identify difficulties, strategies, and supports for development, including environmental adaptations, adaptive equipment, or even special tools. Fine motor skills develop through a progression. So starting with simple skills such as a reflexive grasp, holding or shaking a rattle, and holding things between their thumb and finger in early infancy. This progresses all the way to cutting with scissors, simple printing of letters, washing their face, and brushing their teeth when they get to about the ages of 4 and 5 years old. If your child is having difficulty with activities of daily living, such as dressing, eating, personal hygiene, and so on, your child might need OT. Barriers to completing these activities may include difficulty manipulating the tools needed to complete the task, such as using a fork to eat, as well as sensory processing needs that impact the ability to tolerate the activity. For example, this could be that your child might not tolerate the buzzing or the feeling of a hair trimmer during haircuts. We frequently see a love or hate it scenario in regards to these daily routines. Sometimes as parents, we tend to default to helping our children because we are in a rush or we know that having the child try on their own could lead to problem behavior. It's also hard to know what expectations are reasonable for any given child. For example, it might be okay to help your 5-year-old brush their teeth, but you don't want to do it when they're 15 or 16. OTs can improve tolerance of non-preferred tasks, increase the skills needed to partially participate in routines until they are old enough to do it on their own. For example, the child might not be able to brush their teeth thoroughly yet, but they can start by taking the cap off, preparing their toothbrush, and brushing the front of their teeth, while mom and dad help follow up with the rest. Older children might be able to complete more complex skills of daily living. So think about your preteens, teenagers, and adolescents and what they might be able to do for themselves. Are they able to make a simple meal and snack, use a microwave, or understand appropriate eating habits? Consider the new skills required during adolescence as well. Can they manage personal hygiene materials, such as razors, deodorant, feminine hygiene products, hair, skin, and nail products, and basic grooming in these areas? And also, do they understand the body changes that are happening and why they're happening to them? This is also a key component to that social participation piece. Building these skills can take time and a lot of practice, but OT can help. If your child is having meltdowns in response to normal, everyday activities, your child might need OT. This could be a sign that your child is experiencing some oversensitivity to their environment. Oversensitivity might be more or less obvious depending upon the child. A child who is verbal might tell you that the lights and sounds are bothering them. Children who are nonverbal may push, hit, kick, or run away as they are trying to escape the environment and the sensory input that is upsetting them. Sensory processing differences. We receive information from our environment through our 5 senses: sight, touch, taste, sound, and smell. We also have systems in our body like proprioception, the vestibular system, interoception, that help us identify when we are hungry, tired, or sick, which is interoception. Proprioception is the input to our muscles and joints to know where our body is in space. And the vestibular system is our inner ear, which helps tell us where we are also in space if we're upright, upside down, or on our tummy. Our brain filters sensory input and decides whether it's something we need to pay attention to in order to stay safe, or if it's something that we can ignore and continue focusing on our task at hand. We have to ask ourselves, is our reaction appropriate to the sensory input that we're receiving? For example, it's appropriate for our body to go into fight or flight if we see a car speeding towards us, but it's probably not appropriate to go into fight or flight when the hair clippers come out for a haircut. Sensory processing differences. We all process sensory input a little bit different, and every child's sensory systems are different. Some children need a lot of sensory stimulation to feel full or calm, while others only need a little bit. Some children tend to be more active and need the sensory strategies in order to calm their bodies, while others might need sensory strategies to excite them and get them to engage in a task. This is a great explanation from a child with autism about how he perceives sensory processing differences. This example gives us a visual to understanding the sensory system and how it might make sense to caregivers.
Everyone has 7 sensory systems. They are sound, taste, smell, vision, touch, proprioceptive, and vestibular. Under-responsive versus over-responsive. You can think of each your sensory systems as being a cup, and water is that type of a sensory input. If you are under-responsive to a certain sensory input, it is like you're a big, huge cup. You keep getting water to the big cup. You can just keep adding and adding, but it never feels full. But if you are over-responsive, it is like you are a tiny cup. All you need is just a little sensory input and you overflow. You want your cup to be full and not spill over. Each of your sensory systems is their own cup and they are different sizes. Just because you have one big cup does not mean you are under-responsive with all your senses. I have a big cup for my proprioceptive and vestibular senses and a little cup for my touch, sound, taste, and smell senses. Everyone is different and unique.
In general, when we encounter these types of concerns, occupational therapists can help parents consider questions like, can my child do the task, but I am just jumping in due to time constraints so we can get the task done quickly? Does my child understand how to do the task? Does my child lack the physical skills needed in order to complete the task? Have we made unusual changes in our daily routine just to get by? Are there things that we just don't do anymore so we don't upset our child, such as using a blender, vacuuming, or using a hairdryer when the child's awake, just to avoid upsetting behavior? OT addresses sensory processing differences, fine motor skills, and activities of daily living. It is important to consider OT when your child has difficulty using their hands to play, or with dressing, feeding themselves, or with personal hygiene. It is also necessary to consider OT if your child has meltdowns in response to everyday activities or appears extra sensitive to their environment. School-based occupational therapy services are provided by the school and delivered within the school setting. Private occupational therapy services are covered by insurance or self-pay and occur in a clinic. There are individual differences in sensory processing. Some people may over-respond and some people may under-respond to their environment, with or without having autism spectrum disorder. Again, thank you for your time today. I hope you learned a little bit more about what occupational therapy is and how it might support your child and your family. If you have any questions, please reach out to us. Thank you.